Okay, guys, now discussion D explains palliative care for those who do not know or need further information. So here we go with D for you. Palliative care focuses on relieving distressing symptoms to improve quality of life for individuals experiencing serious illness and their families. Five generation, uh, Five general stages of palliative care act as guidelines for palliative care providers, but the stages may or may not be followed in order. During the first stage of palliative care, the person is considered stable. The palliative care caregiver team notes the physical, mental, and other needs of the individual and works with the individual and their loved ones to make a care plan. Healthcare professionals who may be involved in making this care plan include doctors, counselors, psychologists or therapists, pharmacists, financial assistant, specialists, then professional live-in or visiting caregivers, social workers, religious or spiritual leaders, dietitians. This plan will likely change as needs and circumstances change, but it provides a basic roadmap for beginners for the beginning of palliative care. Legal considerations such as advanced directives, financial power of attorney, and healthcare proxy may also be examined, which may which may necessitate the involvement of a lawyer. Unstable, insecure stage. During during the unstable or insecure stage, existing problems may increase in severity or new problems may arise that were not anticipated in the existing plan of care. This can include a need for emergency treatment or an urgent change in the plan of care or a sudden change in family or caregiver circumstances that impact the individual's care. Psychological, emotional, and spiritual support may be important during the stage as the individual adjusts to new circumstances or symptoms. Support may come from counselors, therapists, psychologists, psychiatrists, religious or spiritual leaders, or other professionals. Support is also offered to loved ones who are likely to be experiencing an emotional toll. uh, deteriorating stage. During this stage, the illness may be progressing, not responding to treatment, or beginning to worsening symptoms, which negatively affects quality of life. Not everyone who receives palliative care progresses to this stage. It is possible to remain in stages one or two palliative care for many years, or to recover from the illness and no longer need palliative care, such as cancer, ongoing uh, cancer going into remission. Individuals in this stage may require more advanced treatments and care, increased at home care, or preparations for hospice may be considered. This stage is the focus. This stage, the focus is on providing comfort and pain management, as well as emotional support for individuals and loved ones. Spiritual support may also be offered for those who want it. The palliative care team will help the individual maintain as much independence as possible by offering supports such as home health aides, certified nursing assistants, volunteers, and others who can help with needs such as bathing and grocery shopping. Needs are frequently assessed, and the care plan is adjusted accordingly. Palliative care versus hospice. Hospice is a form of palliative care, but they have distinct meanings. Palliative care can begin at diagnosis and occur at the same time as creative or management treatment. Hospice care is given for individuals who have stopped creative treatments and will not survive their illness. It is typically offered when a person has a life expectancy of 6 months or less. Terminal stage. This stage is also referred to as end of life care. At this stage, the individual has a life expectancy of 6 months or less, and their condition continues to decline. An individual who's at the end of life may experience in decrease in food take, difficulty swallowing food and medications, loss of appetite, significant mobility issues. During this stage, focuses on physical, psychological, and spiritual comfort care with frequent care plan reviews. This stage is difficult for loved ones as they are faced with saying goodbye. The palliative care team is available to offer support to loved ones as well. The individual may remain in their own house or move to a care arrangement such as a hospital, hospice facility, or nursing home. Bereavement stage. This stage is for supporting loved ones after the individual has died. Bereavement care helps loved ones navigate through the grieving process. Support may be offered include connecting with support groups, psychologists, and counselors, and support from religious or spiritual leaders. What providers are involved in different stages? People receiving palliative care can typically remain under the care of their primary healthcare provider with the support of providers who specialize in or are trained in palliative care. A palliative care team may include doctors, nurses, nurse practitioners, physician assistants, psychologists, and other mental health professionals. Social workers, spiritual leaders, registered dietitians, massage therapists, physical therapists, occupational therapists, pharmacists, financial advisors, legal advisors. Palliative care may be available through hospitals, home health agency, cancer centers, long-term care facilities, hospice facilities, palliative care clinics, palliative care units within a hospital. Who determines the stage? Who determines the stages of palliative care? The World Health Organization organized palliative care as a distinct specialty in 1990, separate from hospice. Who described the goals of palliative care as the assessment and prevention and a multidisciplinary team of physical and psychological and spiritual problems in individuals experiencing life-limiting illnesses or injuries. Palliative care teams work together to determine the stage of palliative care and individuals is in what their unique needs are and how they can best be supported. Where to find palliative care services? When seeking information on available palliative care services, your primary care provider or specialist treating your illness is a good place to start. Palliative care in the United States is usually covered by health insurance, including Medicare, Medicaid, if you're not covered or are unsure if you are talking to the hospital's financial counselor or social worker for resources may be useful in finding palliative care. Include Center to Advanced Palliative Care Directory, Department of Veteran Affairs, Medicaid, Medicare, National Alliance for Care at Home Directory. Key takeaways. Palliative care focuses on improving the quality of life for individuals experiencing serious illness and their loved ones. Palliative care can have 5 stages: stable, unstable, deteriorating, and terminal, and bereavement, but not all individuals process to all stages, and the stages may be experienced in different order. Palliative care is interdisciplinary, involving a team of professionals that may include doctors, nurses, therapists, spiritual leaders, dietitians, and more. Read the original article on verywellhealth.com, guys. So that is D for you. I will see everybody for shows on Monday. For now, Gator Wellness, take care, folks.